Health and fitness go hand in hand, especially if you look at nutrition. So you can have people who aren't that healthy because they eat a very, very unstable diet of fast food.
KJ's like me.
All sorts of kebabs, burgers, chips, whatnot. But then they work out and they're gym guys and or gym girls, whatever. And so they're actually fairly physically fit. They're quite strong, but they're not necessarily all that healthy.
Yes.
So that's where health and fitness don't quite correlate the same. Most people who go to the gym are conscious about what they eat.
Okay, of
and
course.
so most people who are fit will be healthy as well. But then you also have certain people who have a very, very good diet. I mean, avocado toast, drinking only water, avoid fizzy drinks, sugars, saturated fats, etc. But if you ask them to go do a bleep test or even run up the stairs...
Yo, I remember those bleeps. I used to hate them in school.
I asked them to run for the bus even. People panic and thinking, what? Am I that unfit? So,
Hey guys, welcome again to Nana&Jay podcast. We have here Dr. Emeka, who's a emergency physician and also a social media doctor. He's going to be talking about health versus fitness and breaking down the differences between the two and what it actually means for you and how you can improve both of them. So make sure you check it out, like, subscribe, and I'll see you there. Really excited for this segment. We have the Dr. Emeka on to talk to us about health and fitness. Indeed. So excited to have you on, brother.
Cheers.
Can you tell us a bit about yourself?
Yeah, so my name's Dr. Emeka Okorocha. Many people don't know me as Dr. Emeka. And I'm an A&E doctor currently, NHS doctor, author of Your Health in Your Hands, a health book to get people to get their life right. And I'm also a health influencer, which means that I work with a lot of brands, including a lot of charities as well, speaking to young people about health and doing a lot of health promotion through a variety of different mediums. So I've done some TV shows, I've done documentaries, obviously I've done the book, and I do a lot of my own content on social media, platforms like TikTok and Instagram as well, and then anything that promotes health, basically.
Yeah, 100%.
How do you balance all of that?
that
Even as you said that now, that's the first thing that comes to mind. How do you balance all of that different workload? It's television commitments, the health stuff, the fitness stuff, the book, which obviously we'll talk about. How do you kind of balance all of that?
It's difficult, but it's simple because like right now, so I get to create my own shifts. So basically I get to pick the shifts that best work for me. When I go into my training, which I'm going to go into potentially in summer, that's going to be different. I'm going to have a set rota, so I'm going to have to work around it. And then also with media opportunities, you could say yes to the ones that obviously you can make it to. So for example, they might ask me tomorrow, last minute, to be on Sky News, and they could be like, can you come in at 5 a.m.
Of course.
For the 7 a.m. breakfast show and talk about this new headline for health on Sky News. But then you might have a shift.
Of course.
At 3 in a hospital in Essex.
Of course.
So you'll do your Sky News, you come back, you'll chill, you'll sleep, whatever, and then you'll go and do your shift.
Of course.
And then the whole thing will rotate. So with the media work, a lot of it's my own, so I get to do it in my own time. But when you're on TV and stuff, especially live TV, you don't really get to pick the times. And that could be a little bit tricky balancing that. But then certain shifts you won't take because you know, okay, I can't make that because I'm going to be on Jeremy Vine 100%. Or Good Morning Britain or whatever. So I just have to work around it.
And how do you kind of figure out which brands to collaborate with and which opportunities to do?
That's a good question.
Versus the ones not to do? Because
you get approached by everything.
Yeah, I can imagine.
But I think one, you have to see if it's reputable. Is it a brand that I myself have personally used? So I work with brands usually that I myself have experienced because if I'm talking, especially from a health perspective about a brand, it needs to be something that I myself have tried, my own personal experience, rather than just promoting a brand that's paying me to promote them. So usually I'll check about the brand. I'll check obviously about the research if it's a product, for example. So I did a campaign for skincare for children. Yeah. And so I obviously worked to make sure the product hadn't been tested on animals and it was reputable and it could be used for children of all ages with different comorbidities and checked how safe it was and the research they've done on it. So I do all that before promoting it because anything that happens, it could come back to you. As a doctor, people will listen to you when it comes to health advice. So if you're giving something advice that it has an adverse effect on their health, they'll come back to you and say, well, this doctor said to use that and this did this to me.
So this segment is all about health versus fitness, which I think you are the master in, right? Because not only obviously are you a healthcare professional, but obviously you're obviously a fit individual as well.
Yeah,
chiseled man.
So we're gonna get into that segment, but before we get into that, obviously everyone knows you as a celebrity doctor. You're our celebrity doctor, right?
Yeah.
But before we get into that, we want to kind of strip it back a little bit.
Okay.
I feel like people don't really know your background. How did you get into medicine? Like, can you tell us a bit about that?
Yeah, that's a good question. So for my background is I have a medical background from home. So my dad's actually in medicine.
Okay.
My sister as well. And my brother's in med school. So
Wow.
like medicine's always been something we've known. My granddad, he was in medical field as well. And then, so I was fortunate. I got into medical school very early, 18, finished very early at 23. And so when I first started working, because we were quite young doctors, quite inexperienced, the show BBC Junior Doctors came to my hospital. And they asked, would you want to do it? They were like, how old are you? And I was like, I'm 23. They're like, okay, you're in your first year, you qualified. They're like, you got a little bit about you. Would you want to do the show? So I did my audition, my casting tape, and they're like, you were perfect for it. So I was one of the 7 doctors that did it. From that, I got a lot of exposure. People were like, oh, who's this doctor? We can do this with him. I did some work for the BBC. I was working with them. And then after working with the BBC, I got my own agent, Wendy, and then started collaborating with loads of brands. I worked with ITV. I did a documentary over the pandemic. I did quite a few bits and pieces. And the more you do, the more you get seen, the more you get approached. And obviously now having management who approach people for me and they go through the management. So that's kind of how I went into it while still doing my medical training, F1, F2, and then working in A&E.
Wow.
That's a lot. That's a lot to balance.
It's a lot,
That's a lot. So talk to us about one of the really interesting things.
Yeah.
You know, I know that you've done recently. You mentioned was the book that you've done. Talk to us a little bit about what was the purpose. What's the content? What was the kind of the overall?
The basis of the
goal?
book. So the book came along basically based on my TikToks. Okay. So I did a lot of TikToks and campaigns for TikTok and worked with TikTok as a platform. So they basically sent me a fee to create content for them based on health. So I had to do a video a day on a different health topic, basically. Yeah. And I think we'd contracted for 24 videos, so almost like a month. Yeah. And they did so well that they were done again. So we ended up doing I did about 50 plus videos specifically for TikTok health. Yeah. And then some publishers saw this and thought, this would be great if you wrapped all this advice into like a book. That's amazing. They were like, it's very digestible, quite quick, witty advice that young people would read and the older people could benefit from too. So I didn't have a ghostwriter or anything like that. It was all knowledge that I'd put out on TikTok. So I wrote the book from scratch. Every word came from me. And then the publishers just looked at it, checked it. We had to obviously fact check everything, reference everything, because a lot of it's factual information. And then, then we put it out there and it sold. It became a bestseller.
Really?
And on Amazon. It was the number one for quite a few weeks. Actually.
That's dope.
Did quite well. It's still out now in Waterstones.
That's dope.
And Amazon for those who want to purchase it. And now, I can't say too much, but we're going for book 2.
Nice.
Yeah, we have another publishing team who's come and they want a second book. So I actually have a meeting for that tomorrow.
Yeah.
And when you do these kind of like, when you put like these health segments and these books together, how do you kind of think about like the topics that you target? Is it based on a certain, I don't know, demographic or certain topic? Yeah, how does it work?
So I'm a subscriber to a number of different medical magazines. So I get medical news to my phone, updates all the time, and magazines come through. So you look at some of the hot trending topics. So for example, for a while it was COVID and everything related with viruses and getting yourself fit. Also, it's seasonal. So during summertime, it might be hay fever and how to avoid heat stroke and heat exhaustion. Those kind of relatable topics. During winter, it could be like, how to know that you have signs of a flu, or how to prevent yourself from getting the flu, how to keep your immune system strong. Stuff like the gut is all year round. And so topics like that I feel like people are actually going to benefit from. Those are the topics I'm likely to create a video on. And then there'll be stuff like, medically how to prevent yourself from snoring. And stuff like that. And there are a number of different risk factors that promote snoring more than others. So you kind of stay away from those. So stuff like that. Just fun facts and tips. And then obviously fitness was a big part of it because, fitness and medicine go hand in hand. As in we prescribe exercise. So I worked with the NHS with a few of their fitness campaigns, added that to my book, gave some very relatable exercises that anyone could do at any age, at any time, at any place with minimal equipment. Because you want the whole thing accessible for the population. They might look at you and be like, you're a young, fit doctor. Of course you can go to the gym 5 times a week. But realistically, I can't do that. I've got 5 kids. It's difficult for me. I'm working all the time. So you want them to be able to access everything.
So let's dive into that a bit more, right?
Okay.
Health versus fitness, because you mentioned there's parallels, but there's obviously differences, right? Because you can get someone who's very fit, that's unhealthy as well. You can get someone who's healthy, reasonably healthy, but not really conscious about fitness.
It depends. Health and fitness go hand in hand, especially if you look at nutrition. So you can have people who aren't that healthy because they eat a very, very unstable diet of fast food.
Tastes like me.
All sorts, kebabs, burgers, chips, whatnot. But then they work out and they're gym guys and or gym girls, whatever. And so they're actually fairly physically fit. They're quite strong, but they're not necessarily all that healthy.
Yes.
So that's where health and fitness don't quite correlate the same. Most people who go to the gym are conscious about what they eat.
Okay, of
and
course.
so most people who are fit will be healthy as well. But then you also have certain people who have a very, very good diet. I mean, avocado toast, drinking only water, avoid fizzy drinks, sugars, saturated fats, etc. But if you ask them to go do a bleep test or even run up the stairs,
Yo, I remember those bleeps. I used to hate them in school.
ask them to run for the bus even. People panic and thinking, what? Am I that unfit? So, so health and fitness, cardiovascular fitness go hand in hand most times. So like, for example, me, I'll try and eat well. I'll try and avoid too many sugary snacks, unsaturated fats, etc. But then at the same time, I'm going to try and work out as well.
Of course.
So they go hand in hand because I'm going to see more results from my body. If I'm only doing one, you're only going to see half the results or no results at all. If you only focus solely on diet, but you do no physical fitness, you might not feel very, very strong or fresh. If you only do physical fitness and your diet's terrible, you might not look as fit as you want to be.
Yeah,
so.
Of course.
And how do you balance that? You made a good point around the nutrition stuff. How do you make sure that you are taking the right, food and putting the right things into your body?
That's a good point. So actually, if you go on like NHS UK, they actually have a section that a lot of it's included in my book, Your Health in Your Hands.
We'll cut to the advertisement now.
You heard it. You've got a book. We heard you.
So a lot of it's actually there on what a balanced diet is. Because the thing is, I don't believe in fad dieting.
Sure.
Unless, for example, if you're competing in a show. So I know I have a lot of friends who've done bodybuilding competitions and they're competing for a show. So their diet won't be sustainable, but it's what they need for that time to cut their fat as little as possible so they look good for a show. Or if you're bulking up for a fight or something like that. And these diets are seasonal diets and they're not sustainable. But for a natural, healthy, balanced diet that you can keep around, I don't suggest fad dieting. I suggest having something balanced. So you do need fats, you do need an element of sugar, you do need an element of carbs, you need an element of good protein, and then you need stuff like vitamins.
Of course.
I'll promote supplementation for those who need it, but I always promoted that you should be able to get the adequate amount of supplementation in a natural diet, unless you have a restriction. So you might have celiac disease, you might be lactose intolerant, you might be vegan, and so you can't get vitamin B12 out of meat, for example. So you might take supplementation for that. So I think having a balanced diet, a bit of everything, that's the best way to go when you're looking at nutrition.
And does your sorry, I don't know if you've got a question about.
No, I was just on the follow-up question to that was obviously the balanced diet is great, and I use something called my Fitness Pal myself.
Yeah.
And obviously my Fitness Pal has got a breakdown of carbohydrates, protein, fats.
Yeah, exactly.
So just from that perspective, is there a recommendation of the percentage that you should be taking on my Fitness Pal, or
so it depends on your
would
goals.
you prescribe something else?
So it depends on your goals. I think you have, like, for example, 30 grams of protein, which the average male who's 70 kilos should be getting daily. And then you have, like, at least 2,000, 2,500 kilocalories you want to be taking in terms of energy per day. But obviously this is going to vary. So if I'm trying to bulk up, if I'm trying to gym a lot, I'm probably going to be burning a lot more energy and a lot more calories than the average person. So I'm going to need to eat more. So my diet's going to be different than yours. If you're trying to run a marathon, for example, you're trying to slim down, your diet's going to be very different. If I'm going to gain muscle, my diet's going to be very different. So we're still going to have a balanced diet, but I might be taking extra protein. I might be taking protein shakes.
I see.
Which the average person doesn't need to take.
Yeah.
For example, but I have a different fitness goal. That's why some of these apps are good, because it will ask you your body metrics, so your body shape, your body fat, etc. Like I actually did one at the gym because I'm actually doing promotion for a fitness company in the gym currently. And so they took my whole body metrics and then asked, what are your goals? What do you want to do? Yeah. And based on that, it will tell you this is how much you should be eating a protein, this is how much you should be eating a carbs.
I'm scared what kind of information that
I think for you, it says stop the alcohol.
and maybe it's actually, I want to get onto that. But before that, maybe it's a silly question, but does your background, the way you come from, affect does that play a part? Does it affect?
Yeah, it does.
How the kind of nutrition you need to be taking, that kind of, that kind of stuff.
That's actually a very good question, because we know that if you're from an Afro-Caribbean background, you might be at a greater risk of something like hypertension or renal disease just by being black. So what race and ethnicity and gender, these are non-modifiable risk factors for certain diseases. So, for example, I would tell my dad, who's an older African gentleman, to take a lot less salt than the average person might have, just because in terms of cardiovascular disease, blood pressure, renal disease, he's going to be at a greater risk.
Okay.
So I'd be like, based on you're a black person, you should be taking less salt. And then for other demographics, it's different things. So your demographic and your ethnicity can affect your diet and what should be the best diet for you.
And in terms of, I've got a personal goal. I'm going to be a bit vulnerable here.
Okay.
It's, my personal goal is to actually reduce my fat percentage to like under 10%.
Yeah.
Like, that's the goal of mine.
Yeah.
But I have seen from certain literature that's actually unsustainable and unhealthy for a man to have a body fat that low. Is that true?
Well, when you get into the numbers, I think anything lower than 7.65% is difficult, and especially when it comes to women, because women actually need a lot of that fat. Like, for example, if you're sustaining a pregnancy, you can't have a minimum body fat. Or if you're, I think they said somebody, like, I think it was DK Metcalf, the American football player, they said it was body fat like 1.5 or 6 or 1.6%.
What?
I said that's not conducive with life.
Of course.
You need a certain amount of body fat. You, obviously, people want to bring your body fat down. So, like, I can't remember exactly what the metric said my body fat was last week, but I know for myself, between 10 and 15% is a body fat that I'd look good with. Like, if you want to, look vascular, get some abs, etc., you're gonna need to take your body fat down, essentially, no matter how strong you get. So, yeah, I think, depending on what you do, you're not a professional athlete.
Sure.
For some professional athletes, that is
sustainable. Say that.
For some professional athletes, that is sustainable.
Yeah,
and they'll have a regime that helps them sustain this. They'll have maybe a dietitian, maybe a personal trainer, someone who cooks their meals.
Course,
so, for example, like LeBron James, they'll be putting a lot of money into the health and fitness just to sustain them at that level.
Yeah.
We're not LeBron James. But the average everyday man...
You're the same height. So
the average everyday man, it's not going to be sustainable. Yeah. So certain people, yes, but not for everybody.
Okay,
is the correct answer.
Sure.
And in terms of like how people train, because I mean, I'll be honest, I'm not as fit as I probably should be, and my diet probably isn't as good as it probably should be. From a training perspective, is there kind of like a one size fits all? How, if I was to go to the gym and start fresh, how should I be training?
I would say, well, obviously it depends on your goals, but for anyone who's looking to just get into it, you want to have some basics. So you want to be doing at least, I'd say 30 to 40 minutes of moderate cardiovascular exercise per day. So that could be even dancing, that could be football, that could be swimming, that could be cycling. Everyone assumes you have to go pump iron and hit them dumbbells at the gym, but that's not the case. Like, exercise comes in many different forms. So as long as you're increasing your heart rate a little bit and doing some moderate exercise daily, that's when you're going to see sustainable difference over a long period of time.
It's interesting you say that, because I've heard that actually cardio in the gym is not actually required for weight loss. You can actually do steps. For example, if you can maintain like a 10,000 steps or 12,000 steps, you can actually obtain a lot of your goals.
But that's a form of cardio. True. So those steps you're doing, just because you're not sweating out in the gym, like I said, just because you're not sweating out in the gym, some of it actually pertains as cardio. So that's why a lot of people have the watches that will count their steps. So they know if they're getting about 15,000 steps a day, for them, that's good cardio. For example, for me, I'd want to be in the gym. I'd want to be, on the treadmill. I want to be on the row machine. I want to be putting up the weights because I have different goals. But for the average person, who's not trying to gain muscle or who doesn't do fitness modeling like I've done or something, you won't need to do all that.
Yeah, of course. And interestingly enough, you work with a lot of like supplement brands, for example, and so on and so forth. In terms of, and we'll get to women in a second in terms of women's health, but in terms of a man's perspective, what supplements would you actually recommend? As an addition to your diet
so
that you're taking?
Anyone who's going to take supplements, I'd suggest obviously speaking to your health provider first off, because supplementation is only really required if you're deficient. So if you have a deficiency in vitamin B12 and vitamin D, vitamin C, etc., because then it becomes a medication. If you just want basic supplements, I'd say just basic multivitamins. And a number of brands will hit you with a number of different things that their vitamins might have. I'd say check with your pharmacist or health provider if you're unsure. But the standard multivitamins, if you have 1 or 2 a day, as prescribed by the pack, then you should be completely fine.
I see.
And then for someone like me, I'll take protein as well because I'm trying to build muscle. So I'll have a protein shake in the morning or the afternoon. However, for some people, a protein shake isn't beneficial, some people it can actually be detrimental.
Oh,
Yeah,
interesting.
especially if you have poor filtration in your kidneys or you have another comorbidity. That's why I say check if you have any kind of disease. You might not actually want to be taking supplementation because you might think you're doing your body a good thing, but you might be doing your body harm.
And that's where fitness versus health comes in, right?
Yeah,
because
exactly.
You think you're being fit, but
exactly, you think you're being fit by
detriment to
taking
your
all this
health.
protein. Yeah, but it could be busted down your kidneys, especially if you have a pre-existing disease. Luckily, I don't take any regular medication. So also regular medication sometimes can interfere with supplementation. So if you're taking regular meds, you want to be asking a doctor, oh, I know I've been taking this supplementation, for example, for this long. Can I take these medications as well? And then like someone like me, I'd look at it, I'd see what you're taking, I'd be like, okay, there's no interaction. You should be fine if you take this much. Or I'd be like, actually no, because the way this drug works, it works on your liver enzymes or it works on your kidneys. This could be putting a bunch of stress on you. Don't take that. So
interesting.
A question I had, and it's not specific to myself. The topic of
asking for a friend,
for a friend. Alcohol consumption.
Yeah.
What's considered reasonable versus unreasonable? For example, if someone's drinking daily, for example.
So you don't want to be.
It's not for me.
You don't want to be drinking daily. So I think recommended. You don't want to be taking more than like 12 units. A week of alcohol, which I don't know pertains. I don't know how much is in a shot or pertains to like a glass of wine every other day or whatnot. And so you don't want to be binge drinking. So you don't want all those units to be consumed on one day, obviously. So you want to spread it out over the week, and you should have some alcohol 3 days. So if you're drinking, I don't know, 3 times a week, but you have a glass of wine with dinner on a Monday, and then you might have a beer or two with the fellas on a Wednesday, and then you might have another drink, maybe some shots or something on the weekend. Something like that, as long as you're not exceeding the recommended units per week, you should be fine. If you're drinking all of those on one day or drinking consistently every day, that's when over a long period of time, you're going to see the effects, isn't it? Because alcohol's empty calories. Alcohol's calories, that you won't see a lot of people have these beer bellies. And you think you're drinking, so you don't think, because you're not eating something, you think, okay, it's not calorific, it's not actually doing harm to me. People are wondering, why am I not losing weight? And they'll be like, because you're drinking all that wine, drinking those spirits, all that beer. Those calories add up.
So it's interesting. So if, let's say, I'm on a fitness regime, I still kind of want to have fun. I'm not that serious. I'm trying to lose weight, but obviously I want to consume alcohol. I'm in a social setting. We're in corporate jobs, so sometimes you might need to have a drink. Is there anything that you would recommend us kind of going towards?
I would say give yourself days where you know you can drink, or make sure it's like, so if you know you have the work party or function on the Friday, be like, okay, so I'm not gonna go out this weekend because I know Thursday, Friday I got the work drinks. So those will be my drinking days, and I'll have X amount, and I won't push it more than that. And then on the weekend when I may usually drink, if I go to the pub and watch the football, I just won't. I'll have a mocktail, or I'll have a non-alcoholic drink, or I'll just have Coke. Or something else, or a juice. So then you've already pre-planned your week. Because then if you're thinking, you might be like, oh snap, and you find out, oh, I've drank every day this week. And you might look back and be like, damn, I've drank every day this week.
I think some of us find themselves in that position more than others. But we're all saying
That's interesting. And obviously that's gender neutral, right? It's not. As in, you should follow that plan irrespective of male or female.
Yeah, so I think it did change. So I think it was 14, if I'm correct, 14 units for a male and 12 for a female previously, but I think that has cut down. So I think it is now just 12 units for both male and female. Because of the consumption of alcohol in this country, they're kind of because they're trying to kind of cut it down, because alcohol consumption is so clinical when it comes to disease. So a lot of diseases are alcohol related. Unfortunately, in the more developed countries, there's a lot of alcohol related disease here in the UK. And especially some cancers, cardiovascular disease, even stroke, obesity. A lot of these can be related to alcohol. So they're trying to cut down as much as possible, but still allowing the British public to, enjoy it. Because people will drink.
100%.
And plus, it's the economy. A lot of companies make money from drinking. A lot of places are open, pubs, etc. Wineries. These people need to sell and function as well. So people will drink, but they need to do it responsibly.
So staying on that topic of kind of health for the genders, let's kind of switch gears to more kind of women's health, for example. Are there any, obviously I'm not a woman myself, but will it do you have any tips for, let's say, a woman trying to be healthy, trying to be fit? What are like let's say your top 5 tips for women trying to be fit and so on and so forth?
Honestly, I would say, unless you're at a stage where you're trying to reproduce, for example, if you're trying to get pregnant, if you're trying to conceive, or if you are pregnant, or if you're breastfeeding, those are when the rules kind of go out the door because it's very different because your body, your metabolism, everything changes, and the stress your body needs because you're carrying a child. You essentially need to carry a child and have a safe pregnancy. But other than that, I'd say for women, I suggest the same things as men. So make sure you're getting good, adequate exercise. A lot of women think they don't need to exercise because they're like, oh, I don't need to go gym. Like, and I keep telling people, exercise is not just gym. I'm not telling you to go get hench. Like, you don't have to do that as a female.
What is that about? Because I've heard women don't like to do upper body because they have the fear of being hench.
Yes.
Is that true?
Yeah, a lot of women, if you ask them, they'll have different goals. So when it comes to, especially people of our generation, our age, when it comes to gym and fitness, most people obviously want it for the health benefits, which are long term, but short term, they either want to look wham or they want that shelf. They want to look wham or they want that shelf. So a lot of guys will be doing exercises that make them look bigger. They'll be doing chest, arms, back. A lot of women will be doing exercises that make their bodies look better in dresses. They'll be doing lower body, legs, glute day, etc. And they might do a bit of core. You won't see too many women doing upper body. However, some of the women who understand the benefits of just having a strong core and a strong upper body will maybe do 2 upper body days and 3 lower body days.
Makes sense.
What guys maybe do leg day once or twice a week. The rest of it upper body,
of course,
because you're looking at the different goals. However, it's still a form of exercise. So I'd still promote it because even though you're doing lower body glutes, you're still raising your heart rate. It's still a form of exercise. You're still muscle building. So it's not actually that big of a deal. So that's why I tell girls, like, you don't have to go think you're gonna get hench, or like even people do, like, just having a good strong core and having, at least good and strong for your body weight. Like even reformer Pilates. I didn't realize how difficult reformer Pilates were until I tried it. And I realized these women are doing it easy. It takes some core. It takes a lot of serious core to do those Pilates. You think just because there's no big weights, oh, that's calm, it's easy, that's easy. But honestly, I've tried it and I did it for fitness promotion to actually show that this is a good form of exercise. So you don't you could go do dance. Like I don't know if you've ever tried pole dancing, but what they do in them poles, takes
a lot of core,
But when did you try this, Dr. Emeka?
Literally, one instructor, she said, just try this. One basic move just to even hold your core and swing around. And I said, what?
It's crazy.
I said, this takes some serious core and upper body. You don't think of it as that. As in, you'll be on the weight rack on the bench. You'll be like, okay, I'm strong. Try pole dancing.
Different game.
Pilates, different game.
It uses your whole body.
Exactly.
The muscles in your whole body.
Because a lot of people are strong, but they're not necessarily strong for their body weight.
Okay.
So just because you can lift a lot of weights, you might lift a lot of weights and you might be 110 kilos. So you ask yourself to pull yourself, do a pull up or do a muscle up, you won't be able to do that. Whereas a small girl might be able to
do it. You know what's changing gears ever so slightly, because one of the things that we try and get across in this podcast is bringing people that have done, excelled in their field. And giving them a chance, giving the viewers a chance to kind of learn from people that are in positions that they want to be in. And I think, your trajectory of being in medicine, being a doctor, the stuff that you've done up until now is great. And obviously I know a few people that are in that medicine world. What advice would you give anyone that's trying to replicate what you've done? Because I think, you've done a great job doing so many cool things. What would you give to someone that's maybe 21, 23, that's starting off, that wants to follow the same?
That's a good question. And I've been asked that before. My main thing would be just be ambitious and be optimistic about it. Just know it could be done. Like before there was me on TV a lot doing all this stuff, I didn't really see a young black face in the medical world doing it. So I didn't even know if it could be done, you know what I mean? But I feel like I've been fortunate enough to open doors where it won't just be me. Eventually, when I'm not doing this anymore, there'll be another maybe Nigerian boy or Ghanaian boy out there doing the same thing. So that belief is knowing that it could be done, and hard work, fundamental. Nothing comes without hard work. And a lot of people see you and they see you happy and you're making money, you're on TV, and you're doing your stuff and you're writing books and stuff. People don't know the work that goes in it. In the background. So know that nothing comes without hard work and belief, and know that you could be optimistic, and anything, no matter how crazy it is achievable. You like, nothing gets done until someone does it. Someone has to be the first to do anything. LeBron James scored 40,000 points. What, yesterday? Or so? Before that, nobody in the NBA had ever scored 40,000 points. So 20 years ago, people would have said that's not possible. Nobody can score 40,000 points. But he's done it now. So know that you could be the first to do something. Just because your goal hasn't been done by someone doesn't mean you can't do it. So that's what I'd give them.
And one interesting thing that I've always found is, I've always wanted to ask you is, like, do you sometimes get fearful that because you are a doctor, because you work with so many brands, how do you balance that sort of personal presence with the Emeka brand, if that makes sense? Because you are you're an individual as
you
well.
You represent yourself. You
Yeah.
have to distinguish the two. So even if you look at, for example, my socials, my Instagram, there are certain things, personal things that I won't put on there just because I represent myself as a brand.
Okay.
So when brands look at me and people look at me, and patients will even have access to look at my profile. You have to portray yourself in a certain way. Once you go into medical school, the GMC actually gives lectures and tells medical students you need to portray yourself in a different light because you're now representing the GMC, and we have a code on good medical practice and good doctors.
Yeah.
So you can't be out there fighting in the street or being drunk and throwing up on the street. Because technically that's not a crime, but just the look of it, you're representing the GMC. Right? The perception of it for our profession is not good. So there's certain things. Like I'll do, and you just have to do a little undercover. You won't let too many people know.
So staying on that topic is interesting, and it is a bit of a loaded question because it might be difficult to answer. But obviously, you're a black male, right? In a very kind of professional corporate environment, and obviously we kind of deal with this exact same thing.
Exactly.
Now we're on industries. Is there anything that you had to think about or adjust or do, or if there's nothing at all, could you kind of talk about that a bit? It'd be interesting to see your perspective.
You know what? You're very right, and I think you have to conduct yourself and compose yourself in a certain type of way because, unfortunately, the reality is you could be stereotyped. You could be being a black male. You could be stereotyped to be a certain way, or people will have a certain perception of you before you've even opened your mouth or done anything. Of course, Especially I've seen it, especially in the workplace. Sometimes you have to actually go above and beyond to prove yourself in certain aspects and certain, like, I don't know, when I was working, especially when I was at the beginning of my job, especially the way I dress, I'm quite out there and I'm quite confident. And so I gave off the perception, or people had a perception of me that I was really, really cocky, or I didn't like hard work and I couldn't work hard. So for projects and stuff, I had to work extra hard just to prove that I could have a good time and I could enjoy myself, but I'm here to work.
Yeah.
So they'd see me as almost equal, but I was actually working harder. Yeah. I was getting to work 30 minutes early to look at patient lists and stuff like that. The other people didn't want to do, because maybe if I showed up on time, they'd assume I was late or lazy or just doing the bare minimum. 100%. So yeah, it does happen, unfortunately. And there is institutional racism in a number of different jobs, especially like in the field you guys work in the field I've worked in. I've experienced it. My friends have experienced it. Yeah. But it doesn't mean you can't overcome it. 100%. It just means you have to be aware of it and have that insight to know, okay, they're going to see me as this, so I need to do this. I need to be better. My dad taught me that because he obviously came from Nigeria as an immigrant coming into the country, and they saw Nigerian doctors coming in as maybe not as up to scratch as the ones who were trained here. So he knew that just to get to certain places, he needed to work even harder. So that's life. Yeah.
I guess maybe as we round it all off, maybe the final question is, from my side anyway, is what's next? Right? What's in the pipeline? What are you looking forward to over the next 2024? Any exciting projects that you can share?
That's a good question. Well, funnily enough, I actually, because I want to be able to expand my academia, so I could potentially work abroad in the future. And so I've actually applied for GP training, which I'll probably be doing less than full time, so I could continue my media stuff. But I did my exams, passed my exams in January.
Congrats.
Well, thank you. So job offers and stuff will be coming out actually from Monday. This week from March 4th. So I don't know when this airs, but
that's sick,
I'm looking forward to that.
Man.
Hopefully I'll get a nice placing in a hospital of my choice.
Of course.
Other than that, I'm obviously having meetings about book 2, which I'm going to have to try and concurrently be thinking about ideas I'm writing following starting my training potentially in August. And then on the side of that, I've actually auditioned to be the health presenter of a big show coming out on a big, well-known network. Can't say too many names on that. I'll tell you guys off air. But yeah,
so you got some big stuff happening.
So that's probably going to be commissioned and going down around summertime too.
Nice.
And then at the same time, I'm doing a lot more motivational speaking, a lot more charity work, especially for young people. And in and around London, speaking at schools, speaking at events, speaking to children. I think that getting them involved in healthcare from an early age is really important. 100%. So I'm working with a bunch of different brands and the NHS to do that. So we continue.
Yeah, no, that's good, man. That's good. And I guess from my perspective, bro, you're doing so much for the community and stuff like that, man. We love it, man.
Thank you, man.
And just to round it off, I'm just wondering, in terms of how you let your hair down, what do you do to just chill out, have fun? obviously you don't.
I'm quite a quiet person. Chill at home mainly. A bit of a homebody. But nah, I think obviously having a good work-life balance is important. So making sure that you have ways. I love health and fitness. So I love the gym. I love sports, playing football or basketball with my friends, even like going out with my friends to events as well. Having a good network helps you de-stress, especially from a job like medicine, which could be quite intense. But I think that pretty much wraps it up. And one thing I want to leave the people is often everyone, especially when you achieve a lot, you'll do X, Y, and Z. And people ask you, what's your favorite achievement? What's your best achievement? Yeah. And the correct answer is always the next one.
I love that.
Ooh,
the next
I love that.
What's your best achievement? The next one.
Yeah.
I like that because you don't rest on your laurels. You won't be like, okay, I've written a book now. I've done a show now. Yeah. I'm a doctor now. I can chill out. No.
Bro, I love that.
It's what's next.
If the audience like this one, check the next one.
Yeah. 100%,
yeah.
100%.
I love that.
I'll be like, what's your best podcast show? And you'll be like, the next
one.
Or the one with Dr. Emeka in it.
Honestly, on that note,
cheers.
Thank you so much for coming.
Boys.
It's been amazing.
Thank
Appreciate it.
Thank you, boys. It's been great.
100%.
Cheers, my guy.
Come on, bro.